Hi, you guys. Welcome back for our daily practice questions. It is day 168 and our Pharm series continues. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminders that we know there's no absolutes in medicine. We treat patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description where it provides you with all of the resources that I offer for first time test takers as well as those of you who may be retesting. All right, you guys, let's get into question number one. It states a 23-year-old patient presents with erythema and pain on the forearm after brief sun exposure. The skin is intact with no blisters. What is the most appropriate treatment? Is it A, apply silvadene cream? Is it B, cleanse with sterile saline and cover with a non-adherent dressing? Is it C, apply cool compresses and use NSAIDs for pain? Or is it D, to administer prophylactic antibiotics? Take a moment and tell me what you got, y'all. All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most appropriate treatment? And as I always tell you, if the stem is looking for a treatment, you need to look and see if they provided you with a diagnosis. If they have not, then you need to run it back a step further and look at those assessment findings. So here, the assessment findings tell us that we have a 23-year-old patient. They come in, they have erythema and pain on the forearm from brief sun exposure, but the skin is still intact with no blisters. All right, so we know based upon the skin intact, no blisters, this is a first degree burn, right? So brief sun exposure has called a first degree burn, only affecting mildly the epidermis. So with this, C is your best answer. You just want to basically do symptomatic management. There's no need for dressing changes or anything like that, but you can apply cool compresses and use NSAIDs for pain to help for symptomatic management. Question number two, a 30-year-old patient presents with a moist, painful red burn with blistering on the upper arm from a scald injury. What is the appropriate management? Is it A, debride the blister and leave wound open for air? Is it B, apply Silvadene and cover with a sterile non-adherent dressing? Is it C, use high potency topical corticosteroids? Or is it D, refer for skin grafting immediately? Take a moment and tell me what you got. All right, so still with the question here, what is the most appropriate management? Again, it's phrased differently, but it's still a treatment question. So when we see treatment questions in the STEM, we look for a diagnosis. If they have not provided a diagnosis, which they haven't in this scenario, then we need to pay attention to the assessment findings so that we can determine the diagnosis. So we have a 30-year-old patient. They come in with a moist, painful red burn that has blistering on the upper arm from a scald injury, right? So with this, we know we see blistering. We have a second degree burn. So with this, the best answer is A. We want to apply Silvadene and cover with a sterile non-adherent dressing. And then lastly, question number three, we have a 45-year-old male patient who presents with a dry, leathery, painless burn over the anterior thigh sustained in a house fire. What is the next best step in management? Is it A, apply topical antibiotic and discharge with oral antibiotics? Is it B, debride wound and apply high potency steroid cream? Is it C, refer for a burn center for surgical valve and fluid resuscitation? Or is it D, begin topical silver nitrate and observe for spontaneous healing? Take a moment and tell me what you got. All right, stem of the question, what is the next best step in management? So again, we're going to look to see if there's a diagnosis provided and there's not. So then we want to look at these assessment findings. So we have a 45-year-old male. He presents with a dry, leathery, painless burn over the anterior thigh sustained in a house fire. All right. So although the patient may say they don't have any pain, this is a full thickness burn, so a third degree burn. So you always want to refer them out to a burn center for further management because they could be without pain because there could be burns all the way down to the nervous system. So just pay attention to those key details and always remember to refer out. So first degree burns don't require any dressing changes or anything of that nature. We're going to do symptomatic management. Second degree burns, where we'll begin to have blistering, you want to do like your Silvadene and dressings for those scenarios. And then and always, keep those areas clean and intact. And then stage three, like this, always refer out. You need a specialist involved to gauge how much damage there is and repair accordingly. Because again, it's a full thickness burn, so it's incorporating all layers at this point. All right, you guys. I wanted to kind of slowly break down burns and all of the stages in this treatment series as well. So I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, as always, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one, at gmail.com. Everything that I do offer is linked in the bio of this channel, as well as my website. And my website is also linked in the description of this video, where it houses all of my resources that I provide for first time test takers, as well as those retesting. So if you need any of my resources, feel free to reach out. But as always, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.